She's not on the speaker.
Okay.
All right. Well, welcome one and all to the next session of our BALI Speakers Forum. Tonight, we have the pleasure of listening to Devorah Levy. And Devorah grew up in Philadelphia. Her family belonged to a Havurah, which met in members' living rooms for many years. Her bat mitzvah was a Havdalah service, so she could create her own service.
Nice.
She took her first dance class at age 12 and continued to dance and perform through high school and college. Devorah graduated from Hampshire College in Amherst, Massachusetts, with studies in dance and ritual and environmental science. She received her first acupuncture treatment in the spring of 1987, and her life was forever changed. Devorah is a licensed acupuncturist and Eastern medicine practitioner. She graduated in 1992 from a 3-year program at Northwest Institute of Acupuncture and Oriental Medicine in Seattle. She also completed a postgraduate internship at Jiang, did I pronounce that right?
I think so.
Okay, Jiang College in Hangzhou, China in 1993. She received her master's and herbal certification in 1996. Devorah continues to learn and train in various energy modalities, which form and enrich her acupuncture practice. And now Devorah is going to tell us a whole lot more about it.
Yes, indeed. So, I'm going to talk a little bit about my journey from dance to acupuncture and then to Beit Aleph, which I see as a continuous stream going towards into this community. And then I will talk specifically about acupuncture. I have a slideshow on that. And then at the end, if there's interest, I will do a 5 to 7 minute visualization meditation. And then if people have questions, we can talk. And if any of you have questions personal questions that you want to ask me, you can always call me or email me. And I'm open to talking anytime about acupuncture. I love talking about acupuncture and all this stuff. So, all right. So I grew up in Philadelphia, and my parents were very active in their community, and they created a Havurah that we were part of. I think it started in 1970, and they also started a food co-op, as well as a alternative school that I was very grateful that they figured out that I was very challenged in public school. I was challenged with dyslexia, and so reading and writing, spelling was very challenging, and speaking in front of people was particularly difficult. I would get very shy, get tongue-tied. I still sometimes get tongue-tied. And also looking back, I don't think they had this terminology back in the 70s, but I was a highly sensitive child, highly sensitive person. So I feel and see and smell a lot, and I didn't know how to deal with it as a kid. So I was overwhelmed a lot. I was sick a lot. And when I was 12, I took my first dance class. And for the first time, I felt that I could communicate and I could be present. It was like this new language that made sense to me. I started taking dance classes all over the city. I wasn't shy about dancing. I'd go to classes where I didn't know anybody, and I was comfortable and enjoyed it. And one summer I took a intensive, and part of the intensive we did improvisation. And doing improv was another language, another way of communicating, playing with people's energy. There was a structure, there was another person, there was music, and playing with it. And that, it turns out, was my favorite way of dancing. Technically, I was never a brilliant technician, but improv and communicating emotion was something I was good at through movement. And I still feel like that I improvise with my patients every day. I'm playing with energy. I'm seeing what's showing up. So that skill that I discovered at like 15 or 16 is still something I use regularly. I went to Hampshire College, which some of you might know is a very alternative school, and I studied dance and environmental science because I thought I wanted to be a scientist. I spent some time in Israel in a work study program and discovered I did not want to be a scientist. But my studies in dance, well, I've learned also a lot of different movement therapies, visualization, Alexander technique, authentic movement, and body-mind centering, which were all, again, showing me that for me, dance was about healing. Dance was about expression, about helping me articulate how I felt. Authentic movement work is about allowing the movement, the impulse to move, to be expressed and connect with a collective unconscious. So as opposed to
You muted Devorah.
Thank you. So authentic movement also gave me this skill where there's a mover and there's a witness. And I learned in this technique how to hold space, how to hold sacred space so someone could go deep and have their own personal experience. And so that was, and I did do a year-long training with authentic movement with somebody here in Seattle, Jeannie Castle. That was a little bit later. And then in 1987, someone recommended I try acupuncture because I had really, really bad periods. And I had a week long of depression, 12 hours of writhing pain, topped off with a migraine. So, and that really affected my ability to dance and to be present because I was in pain and didn't feel great about 2 weeks out of every month. And acupuncture really changed my life. And the way that acupuncture, Eastern medicine looks at the body, looks at the energetics made sense to me. It was giving me explanation as to why I had these patterns and how to correct them and how to change them instead of just correcting the symptom of taking pills so I would feel no pain. It actually eliminated the root of the cause. So I moved out to Seattle in 1988, and I was more and more interested in acupuncture and Chinese medicine and how it worked. And I ended up applying to school. And on the questionnaire, it said, why do you want to be an acupuncturist? And I was like, I didn't know I did, but here I am. It was like, again, this guide. I really feel like I was guided to going to acupuncture school. Like I was guided to dance. I was guided to Hampshire College and all that, those gifts, acupuncture. And now I was in acupuncture school. So I was there 1989 to 92 was a 3-year program, completed 800 clinic hours. I completed an internship in China and I traveled quite a bit in China. An experience that was eye-opening and learned I could get through a lot of struggle that I didn't know existed in life. And they practice acupuncture very, very differently than we do here. You would not like the way they practice acupuncture. And I really, when I came back, I started my practice. So 1994 is kind of when I say I started my acupuncture practice, because I quit all my other little jobs. And when I came back, I also started practicing yoga with Kathleen Hunt at Samadhi Yoga. And again, yoga is this energetic medicine. It's movement and chanting and breath work, all moving energy. And in the Ayurvedic tradition, Om created the universe, the sound of Om. So again, it's vibration, and acupuncture's energy, vibration are all the same. I mean, it's the same language, just a slightly different perspective. I also started studying acutonics, which is using calibrated tuning forks, which I did bring too, so you could see them. They're all based on the planets, and it's based on Chinese medicine and different sound therapy. And so this is something I incorporate also in my acupuncture practice. And again, sound, vibration, putting these on the points, the vibration goes deep into the body, deep into the cells, and there's profound change with this technique. I also studied Reiki. I'm a level 2 Reiki practitioner, and I started Reiki for my kitties. Kitties love it, because kitties don't, they're like, oh, there's energy, thank you. They're not involved in time and space. It can be sent. I can send Reiki energy. And that was my first experience of learning that energy really can move through time and space. You don't have to have someone right in front of you to work on them. And that was another expansion of understanding this universe and the multi levels that it exists. And then I also studied something called matrix energetics, which again is another, it's based on kind of quantum physics, and that energy is everywhere, and there's patterns that are all around us that we can tap into. And again, it's playing. The teacher, Richard Bartlett, talks about playing. He doesn't like to say we don't work energy, we play with it. So again, that improvisational energy that I love with dance came back. And it's just like, oh, and it also gave me a sense of what I was playing with, because I've always known, I've sensed things over there and I've sensed things there. But this matrix training gave me a deeper understanding of how I worked and gave me another tool to work with people. And that was in 2012. And in 2012, I also started coming to BALI regularly. Now, I had been several times in the late 90s, early 2000s, but being someone without a car was challenging for me to get there. But I was friends with Rafe, who many of you know, because he came to my yoga studio and did performances there. And I went to a Shabbat that Rafe and Rabbi Olivier did. And then when I found out that Beit Aleph was moving to First Baptist, I knew it was my home. And I remember meeting Cindy pretty quickly, and the Kabbalistic vision of that this infinite energy is light, and that light going through the different levels and then into this level, this human level, this body, it manifests. So it's light manifested. That's what we are. And that language connected deeply with me, and everything I've learned, all of the teachers I've had, every step I've taken has brought me deeper and deeper to this understanding that we are just light and energy, vibration, and that we can change. Things can change in an instant. We don't have to, we have this body, but we're not this body, right? This body is light. So there's this space between the cells. And I'm not going to go deep into this part, but it's amazing. and I continue to learn, and I'm very grateful of all these teachers. So that's my story, how I got from a dancer to acupuncture to Bait Olive. Now I'm going to talk more about acupuncture. I hope that's okay. But I would actually like to just, give thanks to this community, to Bait Olive, to Rabbi Olivier, and all my teachers, all my dance teachers and yoga teachers, and everyone who has helped me, guided me. And I do feel like this guide, this future, sometimes I think about it as my future self guiding me to all of these places, and it's quite lovely. So,
Devorah, can I ask a question?
Yeah.
You said that we wouldn't like how they practice acupuncture in China. So what does that mean?
Oh, they're very intense, very, very intense needling. So, and you don't have privacy. You're in a big room with a bunch of people getting needled. That's how they practice it, at least in 92. And we can talk about it more. It's not something I really want to talk about too much.
Okay.
But just know that acupuncture changes with every country it's gone to. Japanese technique is very different than Chinese technique. And then there's Korean hand acupuncture. And then as it's come into the US, it's also changed dramatically. So, and each practitioner is different because, like, as I said, all of these techniques that I just talked about is part of how I give my treatments. And another practitioner will be a little different, but, we'll have a conversation if you want. We can talk more at the end. So, so to talk about acupuncture, I'm going to do a little slideshow. So I'm just going to bring that up. And so this is my information. If any of you, it's just my name, DevorahLevy.com is my website, and my email, and there's my phone number. And I'll bring this up again at the end. So you can get that information if you want it. And this is a slideshow that a friend of mine, Jeffrey Grossman, who also created my website, put together. So there's some slides I'm going to go through quickly because otherwise it's a 20-minute presentation and I don't want it to be quite that long for you guys. So, and can you see that?
Yes.
Okay, so actually, there we go. So, acupuncture, ancient medicine for a modern world. So, acupuncture is over 5,000 years old, and it was every philosophy and political realm that came through China influenced it. Confucianism, which was around 500 BCE, Taoism in the 6th century, looking at the body as a microcosm of the universe. All of these have influenced acupuncture over the centuries. So Huangdi, this guy, is considered the father of Chinese medicine, and he was alive around 2690s. He wrote The Yellow Emperor Classic of Internal Medicine, and this is a book that we still use today. So in it, it discusses all the different energetic patterns, was already developed. So that's like 4,000 years ago or so. I can't do the math, but for a long time. In the Ming Dynasty, which is 1500s, a book on acupuncture was written, as well as a very detailed book on materia medica or herbs. So, and then in 1000, there was some bronze statues that depicted all the meridians and points that were already defined by 1000 AD. So acupuncture has been around for a long time, And these theories and practices have been worked on throughout the century. And then in 1954, the Chinese Ministry of Public Health systemized and organized this body of work and created what became traditional Chinese medicine, TCM. And that is what I was taught. So before that, it was passed down through family lineage. So there were some differences in point locations, some different ways of treating. There's many different theories, as you would expect after 5,000 years. There's a lot of different theories. And as it grows and it reached other countries, as I said, Japan has its own practice, a very different kind of energy style, as does Korea, and as does the US. So things continue to change, even though the base of the theory has been around for quite a long time. Oh, and the American Medical Association was founded in 1940. So I think we're a little older. So this is just a slide of some of the things we're going to talk about. So Chinese medicine, the gardener within. We often talk about taking care of the inner energy, watering it, nurturing it. So the image of a garden is often used in some of the language in Chinese medicine. Chinese medicine supports the whole person. We don't separate the leg from the hip. Often I ask people multiple questions like, how's your digestion? And then, do you have headaches? And what's the pain like? Because sometimes there's a relationship between these different aspects that maybe other people don't see. And everything is interconnected. Our gut is interconnected with our lungs, for instance. And every one of us has an innate capacity for healing. And I really believe that acupuncture stimulates your own body's healing process. And sometimes we just need a little support. Sometimes the illness is really strong and we can't fully heal. Sometimes our injury is great and we just need support. And our life is very stressful. So we often need some help. And the best cure is prevention, right? In ancient times, acupuncturists would get paid while the patient was healthy. If they got sick, they didn't get paid until the patient was better. So the best cure is prevention. And this is something that has been part of the philosophy for a long time. So the body is a garden. So here's that idea, the nourishment. For a while in China, they were dredging the channels. They were clearing rivers and creating irrigation systems. So sometimes we talk about dredging channels in the body. We have a unique medical language. We talk about yin and yang. We'll talk more about that in a minute. Qi and Jing and Shen. Some nice graphics. And then weather. We'll talk about that in a minute. So yin and yang. We all know this symbol. Yin and yang, everything is more yin and more yang. But there's a movement. There is energy. It's always changing. It's not set. And as you can see in the symbol, there's a little dot of yin and yang in each element because things are moving and changing. So when I see somebody, I'm asking them questions. I'm trying to figure out if there's more yin or more yang and how to work with that energy. So Qi is the energy that enlivens and animates. It is what makes us alive. It supports our daily activities, provides nourishment for every cell, tissue, muscle, organ, and gland. It activates and animates, transforms and transports, warms the body, protects and defends. We have a defense Qi that's underneath our skin, contains and retains energy. A sufficient balance and continuous flow of Qi is good health. to have life is to have chi. No chi, no life. So, and that's what I'm working with as an acupuncturist. I'm working with the body's chi. And they have found this to exist. Chi travels through the body, and they have discovered that this does really exist. There's lots of different theories about it. But the lung energy is where the chi starts at 3 a.m. And some of you might know, like there are monks and other practitioners who get up at 3 a.m. to do breath work. And that's why, because the chi is strongest in the lungs between 3 and 5 a.m. Doesn't mean it's not there the rest of the day. It's just it's strongest. So then it travels through the body, through these different organs. And these organs represent the physical organ, but more an energetic complex of qualities. And they're yin-yang pair. The lung is the yin, the large intestine is the yang. And there's a relationship between those pairs, as well as relationships between different elements, which we won't go into because it gets quite complicated. And then the meridians and organs. So this might be kind of where might interest you the most, because these are the meridians, the pathways, and the dots are the points that I had to memorize and learn and know why I would choose each point. There are 350 points on the main meridians, and then there's thousands of extra meridians. And you can see maybe on the hand, you can see there's a gray line that goes from the thumb up into the lung area. That's the lung meridian. And so I can needle up in the chest, or I can needle down on the wrist to affect the lung. So that's how I can needle different areas to affect different areas of the body, and not necessarily have to needle like an injury. Let's say somebody's in a cast. I don't have to needle just where the pain is. Or if somebody's like, no, you can't touch me here because I'm in too much pain, I can do a point along the meridian that innervates that part of the body. So that's, and then these meridians are just the superficial meridians. They also go deeper. They go to the organ they represent. And then there's also connecting channels and stuff, which you don't need to know, but it gets very complicated and very, it's actually pretty amazing that they figured this out. And how they figured it out, well, that's anyone's guess. And so what happens when the chi is blocked? Well, if you think of the chi flow as a hose, it's blocked, no chi. So that's not good. So the blockage of chi creates imbalance. So when someone comes to me, that's my job. My job is to figure out where there's maybe a block. Maybe there's too much chi somewhere, too little chi somewhere else. There's yin imbalance, yang imbalance. Maybe the heart's deficient and or the spleen is deficient and the liver is acting on the spleen. So that's what I've spent 3 years studying, all these different energetic patterns. And it's quite amazing how people fall into some patterns and they're like unrelated when we look at it in terms of Western medicine. But so there's that. And then, as you know, I mean, life affects our health, our diet, our constitutional energy, our environment, our emotions, our work stress, our habits, our lifestyle. All of these things affect the chi. So when someone comes to me, I also talk to them about the different things that they can do to help balance their life a little bit. And then there's what's called Jing, which is really our essence, our constitution, what we're born with, our ancestral chi. And some people equate it with our DNA. It's what we're given at birth. And then our Shen is our spirit. And we can really see that in someone's eyes. a strong Shen, somebody has a strong spirit. And that can relate to mental health issues too. We talk about disturbed Shen. So those are two other terminologies we use a lot. And then we often talk about hot things. I always ask people, is the area hot or red or swollen? Is it dry, cracked, withered, frail? Maybe there's wind, it's changing and moving all over the place. That's more of a wind. There's heat or dampness, where there's sluggishness and softness, and cold is chilly, stiff, achy, cold. So all these different elements give me information as to how to treat it, maybe where the deficiency is, where the excess is, and where the imbalance is. So an acupuncturist views each individual as a dynamic, integrated whole, observing how signs and symptoms weave together in order to understand the underlying energetic profile of a person's health. Kind of different than what some other professions do. So we look at the quality of the chi, of the life, we look at the quantity and the balance. So we're trying to bring balance always to the body. And that changes every day. And we figure this out by looking, asking, a physical exam, and feeling the pulse. We also look at tongues. I don't know why that's not there. Obviously we want to relieve pain, eliminate signs, balance the organ systems, prevent illness. And we have I'm trained in many different modalities. So acupuncture is the main one I use. But there's also herbs, which I'm also trained in. It's harder to get people to take pills sometimes. Moxibustion, I don't use because you have to burn it, and I can't burn anything in my office. Tai Chi Qigong is a movement. Electroacupuncture, I prefer doing the tuning forks I mentioned. Oriental nutrition, I'm also trained in, because food also has energetic qualities, heat therapy, laser therapy, self-care. I talked a lot about self-care, and meridian exercises, gua sha, and they also don't have cupping, which I find I use cupping quite a bit. So I'm trained in all of these modalities as part of my acupuncture license. There's no drug, shots, or side effects. So when we're in balance, when our energy is in balance, we are able to deal with stress, right? Because life is stressful, life happens. But when we're in balance, whether if there's an environmental stress or physical stress or emotional stress or mental stress, we have more wiggle room. We are able to go, okay, here's this issue. And then it doesn't affect us in the same way that it used to. Maybe people get stomach aches when they're nervous, or they get headaches when there's too much. I can tell you from my patients that it really manages stress and therefore your symptoms quite amazingly. So there's an inner resiliency when your energy is balanced. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. So again, if you're out of balance, the chi is out of balance. This is a weird little one. We're not. What is our body telling you? So usually after my patients have seen me for a while, they are more in tune with what their body is telling them, and they can verbalize even more clearly to me how they're feeling. So it helps people really learn more about themselves. And then, I try to help them adopt a healthy lifestyle with meditation, balanced eating, herbs, smiles. I like this one. Exercise, nature, yoga or other exercise, So all of these can help keep your energy more balanced. And that's why it's important to keep doing things, not just to come in and see me and not change anything in your life. I'm going to ask you to, try to do a few different things, because that's how you're going to maintain that balance. Acupuncture is safe, treated billions of people. I think that's safe to say. No side effects. The worst thing I've done to someone is give them a bruise. I'm not sure what the minor adverse events were, but so it's very safe, and can help with immune, infectious disease, degenerative disease, pain, chemical dependency, addiction, rehab, chronic problems. And then this is a list of what the NIH and the WHO say that acupuncture is good for. So there's a lot of different things, a lot of different things that you wouldn't think are connected. And the reason why acupuncture is good at working with all the different symptoms, all these different symptoms, is that when your energy is balanced, your body then heals whatever's going on and changes. So my imbalance is going to be different than yours. So how it shows up for me is maybe headaches, low back pain, and maybe for somebody else it's more stomach issues or their eyes get affected. So that's why acupuncture can really help with so many different kinds of issues. And I would say it's always worth trying, because you don't know just how effective it might be for you. And then I'm going to skip through this one. This is just, there have been some studies for these things. So a lot of them are done in China. So here are some reasons to try acupuncture. It's holistic, a whole body well-being, clear and precise, diagnostic tools. We look at the root. I think this is the most important thing, is we are not just working on the symptoms, we're looking for the root of the issue and trying to bring balance to the root cause. So then the issues really change. As I spoke earlier, with my history of really bad periods, after a couple of years of doing acupuncture and herbs, it changed. My body changed. I no longer had the same pattern. So I didn't take pills anymore to mask the pain. The pain wasn't there. So your body can change. We are not stuck with all the energetics. We might not be able to grow 2 inches taller, but we're not stuck with the same energetics that we have when we're young. Things can change. And I think that's the most important idea I want you to take away from this, that we can change. It's helped billions of people. I love that, billions. I mean, if you think about all the people in China over 5,000 years, it's got to be a couple billion. And it keeps you healthy, again, also in body, mind, and spirit. I didn't talk too much about this, but it affects the mind, the body, and the spirit. And even if someone doesn't talk to me about their emotions, I can feel it. It's within the pattern that I'm seeing, and people often just feel better emotionally as well as physically. And when we're in physical pain, it affects our emotions too. So I'm working on all 3 levels with every patient. So in conclusion, acupuncture works. Exclamation point and underline. There we go. So that is the, let's see, I'm going to stop my share. Whoops. What did I do? I lost Oh. Uh-oh. Where are we? There we go. Sorry. I got lost there for a second. So I hope that presentation was helpful. I hope the pictures were helpful. So if, it's getting late. Are people interested in having a little visualization meditation, maybe 5 minutes?
Yes, but would
Yes.
you remember to put up your stuff? That's how I
Yes.
can get in touch with
Oh,
you.
thank you.
Yeah.
Thank you. Let me just, I'm going to share that for a second so you can see my information, my name and stuff. And again, if you just look up Devorah Levy, just my name, you'll find my website and you can contact me. Now, what I'm going to do is this is something that I started developing during COVID because my patients didn't want to come in. Many of my patients didn't want to come in, which I understood. And as I talked about earlier, that energy can travel through time and space. You don't have to be in front of me. So we're just going to do about a 5-minute little visualization. And so just like you would with meditation, just connect to your breath. If you can, put your feet on the ground. If not, that's fine. Just feel grounded. And in your heart, start connecting with your heart energy. Because our heart is energetically huge. It reaches out further than any other part of our body. It's a field, the heart field can connect us even when we're far apart. And I want you to connect now to the top of your head and allow the energy from above to come into the top of your head. Breathing in, I'm seeing white light. You might see a different color or a different sensation. That's all good. It's white light pouring in the top of your head. And this is a big energetic point. Chinese medicine, it's 100 meetings because all the meridians meet there. And as this energy is pouring into your head, just begin to allow it to come into your brain, down the front of your face, down the back of your face, enlivening all those meridians, enlivening the cells, into your throat, and the energy going down your right arm, and down your left arm, and then having it go down your torso, into the organs, just enlivening, bringing that chi, bringing that light, that force, that vital force into your belly, bringing it down your legs, into the feet. At the bottom of your feet is another big energetic point that connects us to the earth. And now let the bottom of your feet, let the energy of the earth come up and meet your feet. This deep energy from the center of the earth, this magnum, this lava, a nice deep orange energy coming up into your feet, into your bones, into your marrow, into your thighs, into your pelvis, and into the spine and all the nerves, bathing in this deep, warm, orange energy, and up your spine and into your cranium. Feeling this energy surround you and fill you, and up to the top of your head. And know that you're now being held up from the sky, supported by the earth. We are between heaven and earth, and all of our energy is being fed, receiving. And then bring your energy back into your heart space. Take a couple deep breaths. And as you're ready, you can come back to the call. I hope that was relaxing. I tried to keep it to 5 minutes because I know it's getting late. And again, this is something that I can offer. You know, if any of you want to experience it, I'm happy to give you a complimentary session just so you can experience it. It'd be individualized for what's going on for you. And if you want to try acupuncture, you can let me know too, or if you have questions. Yeah, so I guess if you have some questions, then feel free.
Devorah,
Yes.
I have a question.
Okay.
Yesterday, for maybe the first time in my life, and I should say this, that I'm 78, I had an episode, a very close encounter while I was driving. I think that it actually was, it was very strange, the whole interaction was, and my own brain frightened me afterwards when I was thinking about it. You know, so which caused me today to Google, you know, cognitive and executive function in the aging brain. Can acupuncture can your services help me deal with my anxiety about that?
Absolutely. Anxiety, definitely. I work with PTSD, which is kind of, it sounds like you're not there, but you're remembering the event and you're questioning. And so the acupuncture can calm your nervous system down, because when we have a shock, that cortisol gets pushed out and our body is like in the state of shock. So acupuncture is great at grounding, calming, and also I could do a visualization with you if you prefer, not coming in. And so yes, I work with a lot of people who have had trauma of whether it's a little something or a big trauma. And I also work with people who have dementia or have had concussions. So brain function, just in general too, it's actually very good for.
Okay, thank you. I'll be in touch.
Okay, thank you.
Devorah, I've got the question.
Okay.
I've tried acupuncture a couple of times, and it's been remarkably unsuccessful. And I wonder, sometimes I think of it like hypnotherapy or hypnotism, is that you have to be available or willing to let it happen. Is there anything to that? Do you deal with people who seem to be inherently resistant?
I think everyone experiences it differently. And with each practitioner and with each issue or symptom, like I would not want to see my very first acupuncturist anymore. She was very intense. She was perfect for me then, but she wouldn't be perfect for me now. So I don't think you need to believe in it. People come into me sometimes, I don't believe in this, but my, so-and-so told me I had to try it. I don't believe in it. And it works. And then other people who believe, who know it's true, and they don't get results. So it might not be the right modality for you. There might be another modality that would better suit your needs. So, if you've tried it a number of times, I'd be happy to talk to you more at length and see if it's worth trying again. Or maybe I could help you figure out a different modality that might work for you, because we're all different and we're all different at different times in our life. So I wouldn't say give up. I would never say give up. So yeah.
Devorah, what during your practice, are there times when you see something that's going on when you refer people to Western doctor, medical people?
Yes, all the time. I mean, a large part of my training was what to look out for when to refer. There's things I don't treat, and there's things, sometimes there's been people who've wanted to come in to see me, and I'm like, have you seen a doctor for this? And they haven't. And I'm like, I really need you to get checked to make sure it's not something that really needs Western medicine. So no, I'm not a purist in terms of just using alternative medicine. I believe integrated medicine is optimal, because every medicine has a different gift to offer. And so I think using the best of both worlds is ideal. Yeah.
Oh, you're so cool. Can you move to Michigan?
No, we need her here, so.
She doesn't need to move.
Yeah,
Right.
that's
If you
good.
want to
Energy,
move, yeah.
energy travels.
energy travels. So if you want to do an energy, like I said, I'm happy to give anyone who's here now or who watches a recording a free Zoom visualization and see what it does.
Devorah, do you take insurance?
Yes, I'm a provider with most insurance. Medicare is a little different. Some Advantage plans do cover it. It's a little complicated, so call me about that. But I'm on Aetna.
The UW retirement system,
Oh.
I think it's Regions.
Yeah, uniform.
Yeah,
Yeah, you have coverage. You actually will have 24 visits next calendar year.
okay,
Yeah.
I'll be seeing
So
you.
come on in.
I add that I'm a Reiki 2 practice
Mm.
and it works.
Yeah.
It works. I've worked on people on the other side of the world. And but Deborah, I do have a question. You talked
Okay.
about a modality you use. It sounded like matrix energy.
Yeah, matrix energetics.
Oh, okay. I got the name wrong.
It's okay.
It's
And it's Richard Bartlett. He's kind of gone off the deep end a bit, but his teaching was pretty incredible and pretty really changed a lot of how I look. But look him up. He's still doing stuff, and I'd be happy to talk to you more about it. But yeah. Yeah.
Laura, I want to ask, and you don't need to answer this because it's a kind of a personal question, but I know you went through a significant medical situation a couple of years ago.
Yeah.
And I'm wondering if your acupuncture and your approach to holistic medicine gave you an outlook that you feel allowed you to transition through that in a way that perhaps you wouldn't otherwise have been able to do.
Well, that's a good question. I think all of my training gave me an understanding of the body and helped ground me and keep me get through it. But I also felt a bit dismayed that all the work that I had done didn't prevent it. So I guess I'll out myself. I had breast cancer, and but it was caught very early. And my mother had breast cancer, and so did both of my grandmothers. So they were watching me very carefully. And I spent a year and a half before I had surgery because I wanted to try alternatives. And I think that all the work I did made it happen much later in my life. I think if I had not done any of the work, it probably would have shown up earlier. But I felt disappointed that I didn't stop it from happening, because one of the things I really worked on, because as from age 12 to my 20s, I thought for sure I would get breast cancer. That was just my destiny. And then I started changing that mindset, and I thought I had worked through it. I had hoped I'd worked through it. So, being in balance doesn't mean disease isn't going to show up, but it does mean that you will get through it more easily. And I did get through it, I think, relatively well. I healed relatively quickly. And as I said, it was caught early. And so yes and no. It was a struggle. I was conflicted and I was pissed, but it also did help me.
Thank you for answering.
Right, Cindy? She helped me quite a bit as a friend.
We hung in there together.
Yes. So, and Beit Aleph, and the rabbi and everything that I've done kept me grounded.
But you
And
didn't even put yourself on the prayer list. I never prayed.
I did once.
Once?
Well, actually, I don't know why they took me off. I was on there the week before my surgery, but then they took me off. I didn't ask to be taken off, but
well, I would have prayed for you had I known.
Thank you.
And I would have put you in a Reiki sandwich with another Reiki 2 practitioner.
Well, I had Reiki people, and I had a lot of people who energy workers working on me. So I had a lot of support.
My sandwich would have been very unique.
I'm sure. Well, we can talk about that, and maybe I'll use it for other things.
A Reiki sandwich is when 2 practitioners work on somebody at the same time at the level 2 of Reiki practice. What? It's a remote treatment where we're not in the same room with our patient, but we put them in a sandwich, so to speak, and we work on them at the same time. So it's like getting a double, triple whammy.
Yeah. So, well, thank you. I think, is there any other questions?
I have one. I'm
Okay.
sure. What do you suggest? You mentioned people should eat healthy.
We're not going there. That's different for each person, and that's a
Okay.
conversation we'll have.
Okay. All righty. Thank you.
And what exercise too? How much exercise?
Everyone is different. Everyone is different. And, you know, you got to start where you are. The most important thing is to start where you are. And baby steps. Baby steps. There's no absolutes. There's no musts or have tos. Yeah.
Devorah, who knew? This was really quite wonderful.
Oh,
Thank
good.
you.
Very, very.
It
Thank you.
was really great.
Well, thank you for coming. I really appreciate all of you being here. And I appreciate anyone who watches the recording. Yeah.
And you appreciate anybody who signs up for treatment.
And I really appreciate anyone who signs up for treatment or asks for a little free complimentary little Zoom session. Happy. And again, if you want to just chat, we can chat. I can talk to you about whatever's going on and see if would be helpful, or if there's a different practitioner who would be helpful, or how to find a good practitioner in Michigan or wherever you might be. I'm happy to do that. So we can have a conversation around that.
Well, that sounds great.
Yeah.
This is really, thank you so much.
Yeah.
It's very uplifting. And also, I have to say, I really admire how much work you put into this. I mean, not the presentation, although I appreciate that, but I mean, all the years of dedication and training. And I mean, you must be really smart. I don't think I could learn like one little
She
point
is
in the
really
body.
smart. She is really
A million
smart.
little points. I mean, it's just,
Thank you. Well, I'm not scholarly, but I'm very smart.
Being a TLF only has smart people, you know.
Right. I know.
Definitely an empath. Definitely.
Yes, I am. And I've had to work hard not to take on people's energy, but all the things I talked about are there at play. And yeah.
Thank
You
you.
see that? You see that color in my cheeks, everybody? You
Yeah.
brought that to me, Devorah. I
Oh,
mean
good.
it.
Oh, good.
Really?
That.
Little Rosie in
Haven't
the
had that. Look at that.
Thank
Sue,
you
what
for
were you
sharing
saying?
this. Yes.
she said just color in her cheek.
No.
That's what she did.
I heard that. But Susan was starting to say something. Shoshana?
Oh, I just wanted to thank Devorah for sharing her dyslexia.
Oh,
Oh, yeah.
yeah. It used to be a very big challenge. It still is a challenge, but it's also, I've learned the gift, because when we're neurodiverse, we see the world differently and we experience the world differently. And so every way that each of us sees the world and experiences the world, because we're all individual and we all experience it differently. That's our gift, right? That is our gift to the world. So I'm grateful I found my path. And believe me, during COVID, I was kind of wondering. I've been wondering a couple of years before that too. I was wondering, is this really, because you know, being self-employed is always a challenge, but I'm still standing. My practice has been going on now 27 something years or something like that.
Oh,
Mazel tov.
yeah, really.
So
Awesome.
Yeah.
I mean, being only 30, I don't know how it could be that long.
I was
That's
gonna say,
miraculous.
how is that even possible?
Well, thank you. I'm going to go to bed. It's 11
Okay.
Thank you.
Well,
Good night,
Good
everybody.
night.
Bye. Thank you so
Bye.
much.
Thank
Yeah,
you.
Devorah, thank
Bye.
you so
Thank
much.
you.
We are
Thank
going
you.
to, this is being recorded, and so I will post a link to the recording, and you can watch it again, or you can send the link to people who you think might like to see it. In
I'm just gonna
January,
put that up at the end there.
Oh, good.
Yeah.
Yes, that's good.
in January, Carol Grant is going to talk about her mom, who was a Holocaust survivor. And then in the middle of January, Philip and Kim Herzog are going to talk about their search for a place to retire and how that led them to Medellin, Colombia, and what it's like to be living there. So thank
Great.
you all for joining us tonight. I'd love to hear from you with your thoughts on this and future forums. And I wish you all happy holidays and thanks for joining us. Devorah, thank you. It was spectacular.
Stu, thank you so much for hosting this. I really
Yes, thank you,
appreciate it.
Stu.
Thank you, Stu. Thank
you.
you.
Thank you. Thank you.
Good night.
Good
night.
night.
Okay, bye-bye.
Yes.